Imagine that you are a healthcare professional working at a clinic and a patient comes in with different values or beliefs than you. How do you react? A lot of people may not think of this or even realize that it happens. Therefore, I will discuss the concept of ethnocentrism, examples of ethnocentrism, and how are different ways to prevent and avoid ethnocentrism. First, I will discuss the concept of ethnocentrism. Ethnocentrism has existed ever since people immigrated from their countries to others. By definition, ethnocentrism is the belief that the culture is superior or above others and is the standard by which all cultures should be measured by. Ethnocentrism, under circumstances, could lead to dominance of other groups and conflict and tension among groups. The behavior of ethnocentrism is basically the judgment of others relative to the concepts of one's own ethnic group or culture, including language, behavior, customs, and religion. A professor of anthropology explains that ethnocentrism becomes a problem when people from different cultures meet and interact. It prevents people from understanding the other, let alone taking them seriously. The views of others are judged by standards of one's own culture. Ethnocentric feelings are a natural result of having to be adapted to one specific culture. The problem with this is not that we prefer our own culture, but believe in that other cultures should also hold our own values. Next, I will discuss how ethnocentrism is associated with healthcare. While most patients, visitors, and healthcare professionals respect one another, some may view others through an ethnocentric lens. Lack of knowledge about one's own culture can twist the perception of the ethnic patient. If healthcare professionals don't accurately interpret the reason a particular patient is behaving, it is impossible for them to appropriately design interventions and cooperate. For example, some people may prefer home remedies over what a doctor may prescribe, or Westerners view illness as a chance event or as a result of lifestyle choices, but it is important to realize that this way of thinking is not universal. Perhaps the biggest error of cross-cultural understanding is made when a healthcare professional assumes that a patient has the same feelings or reactions as he or she does. Through ethnocentrism, healthcare providers may operate under the idea that how they view things is the right way and everyone must conform to that. For example, a healthcare provider may have trouble understanding why a Middle Eastern man of a female patient doesn't want a male doctor examining his wife, or why Asian patients avoid making eye contact. Overall, it is about establishing professional relationships with patients regardless of how different their expectations may be. This may be very challenging, but it is about providing the best care possible. Now I will discuss ways to prevent and manage ethnocentrism within healthcare. In order to correct this situation, it is important for healthcare professionals to separate their values of their own cultural background and values of the patients that they care for. Although being aware of your own culture and how it contrasts to others is also important to achieve intercultural proficiency, which I will touch base on quickly. Intercultural proficiency is the ability to interact and communicate with people from other cultures and ethnic backgrounds. For example, a person may try to understand the language of other cultures, how others view a way of life, and be able to relate these different backgrounds to their own. With that being said, there is a great value in the learning about other cultures in order to deliver quality healthcare. Some ways of preventing ethnocentrism, not only in healthcare, but in everyday life, may include learning about other groups, making new friends, explore different entertainment of different cultures, attending services from different religions, and traveling to different cultures. By learning about different cultures, it may give you a different perspective and opens potential to learn new things. By understanding other cultures, it can make your life easier and allow you to communicate much better with the people from different culture backgrounds. When dealing with ethnocentrism during practice, it doesn't necessarily mean that you have to agree or accept the people or accept or agree with the patient, but is overall to show respect. Also, experts have said that with the healthcare setting becoming better suited for people, it will allow caretakers to be better prepared to do their job, connect better with patients, and exceed the care provided. Therefore, we can conclude that ethnocentrism plays a role within the healthcare setting along with many other places in everyday life. Not only can a person be ethnocentric with a patient or coworker, but it could occur with a student, teacher, or even a friend. In summary, I have covered the concept of ethnocentrism, the association of ethnocentrism in healthcare, and ways to avoid and manage ethnocentrism in the healthcare setting. Now, having a better understanding of ethnocentrism within a healthcare setting, you can make informed decisions in whether ethnocentrism is taking place and what you can do to manage it. Thank you.